Welcome back. This is part 5 of the anatomy of the heart and lungs. Now, focusing on the lungs. So, the lungs are a pair of elastic, spongy organs that help us to take in air and exchange air when we're done with it. So, we take in oxygen and they breathe out the carbon dioxide. So all the blood that has reached the right side of the heart must be brought to the lungs for proper oxygenation. So the lungs, as I mentioned earlier, is located outside of the mediastinum. So its blood vessels and the airways connect to the mediastinum. So when you look at the mediastinal surface of the lung, you see the roots of the major vessels and of the major airways. So between the lungs is the mediastinum. So the bronchioles, the bronchi are connected to the trachea inside the mediastinum, and the pulmonary arteries and the pulmonary veins likewise connect to the heart inside the mediastinum. So what you see here are the roots of the pulmonary artery. It's colored here in blue just to signify that it carries venous deoxygenated blood to the lungs, whereas the pulmonary veins are colored red to signify they carry back bright red oxygenated blood. And finally, you have the bronchus here, which is a subdivision of the trachea. So the part where the lung connective tissue connects to the connective tissue of the mediastinum is the pulmonary ligament. When you look at the lung, it's also a pyramidal shaped structure with an apex pointed up in the air near your clavicles, and the base which touches upon will just rests above the diaphragm. And the root of the lung is its connection to the structures inside the mediastinum. Specifically, the hilum is that the depression on the lung containing the roots. So the hilum is the area, the root is that area what contains your pulmonary artery and vein and the bronchus. So how do we distinguish the two lungs, the right versus the left? So the right lung has 3 lobes, while the left lobe has only 2, mainly because the heart occupies that space where the third lobe should have been. Thus, due to that extra lobe on the right lung weighs heavier by around 30 grams more. But because of the presence of the liver underneath the diaphragm on the right side, the the right lung is shorter, whereas the left lung is narrower because it is pushed to the left side by the heart and its pericardium. So because of the intervening structures, which is actually the heart, the margin of the right lung is straight, while the anterior margin of the left lung is indented by the heart, so signified here as the cardiac notch. So when you open the rib cage of the cadaver or during surgery, this is what greets us when we open the rib cage. So right there in the middle, you see the lung wrapped inside its pericardium, and on either side of that mediastinum, you see the lungs, which are housed in their own connective tissue. And then below it, you see the diaphragm. And above, you see the trachea, you see the major blood vessels going to or coming out from the heart. You have 3 lobes on the right side, and you have 2 lobes on the left side. So the divider on both sides would be an oblique fissure. with an additional horizontal fissure on the right side that is not present on in the left lung. So here we see on the right, pointed out for you, is that horizontal fissure which does not exist in the left lung. So that's one marker for you when identifying whether this is a right lung or is it a left lung, that horizontal fissure, because both lungs will have an oblique fissure. Both lungs will have a superior lobe and an inferior lobe, but only the right lung will have a middle lobe, which is delineated there by that horizontal fissure. Whereas on the left lung, you see a notch where the heart indents into it. Just like the heart, we look at the planes of the organ being mentioned here. So the planes of the lung, or the surfaces of the lung. So the part that adheres or touches the ribs is thus called the costal surface of the lung. So mainly it's pleura, or the connective tissue. And because the ribs are a continuation of bone from the spine, it's also called the vertebral surface. Then you have the mediastinal surface of the lung, which touches on the mediastinum. So represented here by the pulmonary ligaments and the pericardial concavities. The concavity on the left side. And then, of course, beneath you have the diaphragmatic surface, or the base of the lung. So that space between the ribs and the diaphragm and the lung is a space known as the costodiaphragmatic recess. It is always present unless it is obliterated by usually fluid outside of the lung and above the diaphragm. So here's an example of demonstrating the pleura. So it's very similar to the pericardia of the heart. So there is a parietal part and a visceral part. So it forming a kind of double layer, or a potential space, exaggerated here on the right side. So when a lung collapses, that's what it looks like. So it shows that space outside of the lung, or the viscera concerned here, which is the lung. So the visceral pleura is separated from the parietal pleura by that space. In the normal lung here shown on the left side, it is not that prominent. So anytime the lung collapses, that's the time you see a very large space around the lung. So this is just an exaggeration. Okay, so other things that you see here are the parietal pleura that is closest to the spine of the neck, or the cervical spine. So it's just renamed as a cervical pleura. It is actually just the same pleura, but it's just telling you where the pleura is located. And of course, the pleura that rests above the diaphragm is called the diaphragmatic pleura. And the pleura that is adherent or very close to the mediastinum is called the mediastinal pleura. That is where we see the root of the lung. As mentioned earlier, you have three lobes on the right side, with the additional middle lobe on the right. Whereas on the left, you only have two lobes, but there is a kind of counterpart there in the superior lobe. So a notch for the heart and a tongue-like extension of the superior lobe, where the middle lobe should have been. So here is a nice surface anatomy kind of illustration, showing that the lungs do not completely fill out the thorax. So there is always a space there, and your diaphragm is always rising and falling to help us exhale or inhale air into the lungs. So we see from the mouth, the nasopharynx, then you see the windpipe or trachea, which will split into two major bronchi, which will split and split further inside the lungs into the bronchioles or the bronchial tree, which will continue to branch into smaller macroscopic structures known as the alveoli. So here is a nice animated GIF of the lungs inflating and deflating. So the diaphragm must contract downwards to allow more space for the lung, and in so doing, it produces a vacuum that causes the lungs to expand. And after the diaphragm relaxes, the lungs will recoil back to its contracted state. So like a balloon. So this slide is important in terms of knowing where the structures are using our X-ray vision. Okay. Actually, it's our clinical skills using anatomy. So you know you have ribs and you know you have lungs, which are not as big as the rib cage. The lungs will always be shorter, and in any point in time it may expand or contract or recoil to its baseline shape. So what do we see here? You have the chest plate in front. So you have the sternum in front and the ribs encircling the thorax with the lungs inside. And of course you have the clavicles over there. So when we're trying to deduce where the apex of the lung is, or the apices of the lungs are, we look first for the junction of the sternum with the clavicle. So the sternoclavicular joint. Okay, we draw a line that is 2.5 cms above the middle third of the clavicle. So when we do that, that's more or less where we will find the apex of the lung. So here you have everything else removed, leaving us with the rib cage, with the lungs, and of course like an X-ray vision, imagining where the heart would be, covered by the lobes of the lung. So we use the ribs as the landmarks here to more or less know where the heart is relative to the lungs, and where the lungs usually are when they are not expanded. So your windpipe, the trachea, must divide to enter the lungs. So the moment it leaves the mediastinum, these are called bronchi, the primary bronchus or bronchi. Similar to the trachea, they will also be encircled by cartilaginous rings. So again, anatomical pearls, the right bronchus is more vertical because there is no heart on that side compared to the left side. And this verticality of the right bronchus makes it very prone for patients to aspirate foreign objects. Like in your case, as a practicing dentist, if the patient's denture accidentally falls into their airway, most likely that denture or tooth will end up in the right lung because the right bronchus is more vertical, whereas the left bronchus is more complicated because it has to pass beneath the aortic arch and then go in front of the esophagus and the ascending aorta. So harder for foreign objects to land in the left lung unless the patient's really unlucky. Okay, as mentioned, the primary bronchi will further subdivide as they go into the different lobes. So remember, the right lung has 3 lobes. Thus, for each lobe, there is one uh, lobar bronchus each. Whereas for the left lung, since there are two lobes, you have one bronchus per lobe, so two lobar bronchi. And once within the lobes, they'll now subdivide in the so-called bronchopulmonary segments. Now, you don't need to memorize all this. You just need to know that the lung path, the airways continue to branch and branch in, until they reach the bronchopulmonary segments. Now, there are more bronchopulmonary segments on one side compared to the other side due to the presence of that additional middle lobe on the right. So therefore, the right lung should have more bronchopulmonary segments. So just looking at it here, since both lungs have superior lobes, so both lungs will always have an apical bronchopulmonary segment, a posterior, and an anterior BPS. But since there is no middle lobe on the left lung, there will be an additional superior and inferior um, segmental bronchus for the BPS on that side. So a superior and inferior segmental bronchus for the for the left superior lobe bronchopulmonary segments. All right. So since both lungs have a inferior lobe, both lungs will have anterior basal, medial basal, lateral basal, and posterior basal bronchopulmonary segments. So the additional two bronchi for the right lung would be those destined for the middle lobe. So you will have an additional medial and lateral bronchopulmonary segment. Thus, you have a lateral and medial segmental bronchus or bronchi. So each wedge supplied by a bronchopulmonary segment is a pyramid of tissue. So each comprised by a pulmonary artery, a bronchiole for that BPS, and a bronchial artery as it terminates into the periphery into alveoli. So the alveoli must be accompanied now by capillaries. And from there on, they must return back to the heart. So there must be pulmonary veins from the capillaries to venules to slightly medium-sized veins into the main pulmonary veins back to the heart. Alright, so each bronchopulmonary segment is a pyramid of tissue and thus named after its segmental bronchus, as I mentioned earlier. So, as mentioned, they must have their own segmental bronchus, artery, and vein. So, the right lung, so just for reiteration, has 10 bronchopulmonary segments compared to 8 on the left side due to the additional middle lobes, lateral and medial bronchopulmonary segments. Alright, other differences are just shown here for completion's sake, but not very important for you. Alright. So someone actually colorified the different bronchopulmonary segments. So this is just for art's appreciation's sake. Alright. So important also, since they are units of functioning lung tissue, so they must also have some lymphatic drainage, since the airways are also the first line of invasion or defense for foreign bodies. So the lymph nodes allow your inflammatory cells to travel back to the lymphatic system. Also important when we talk about cancers and metastasis, because these are also pathways for them to spread, so metastasize. So that's the last slide. So thank you very much.